Hi, I'm Rosemary. I'm a student nurse. Is it okay if I get a report from you on one of your patients?
Okay, sure. Here we have Ronald Jarvis. He's a 67-year-old male. He has no known allergies. He's a full code. He came in from his provider's office. He was complaining of elevated blood glucose levels for 5 days, consistently in the 300s. And he has a non-healing wound on his right heel that he noticed approximately 3 weeks ago. He's been a diabetic type 1 for 20 years. And he's insulin dependent. He typically has it controlled in the 120 range, and he typically adheres to an 1800 diet, but he has had decreased adherence over the past 9 months to his diet. So we're going to give him some education on that. He has also noticed some tingling bilaterally in his lower extremities, which has gotten worse over the past 3 months. He tried soaking the wound in salt water and it didn't help, so he came in here. He has orders vital signs Q8, Accucheck CCHS. His last one was at 2030 and it was 242. Activity is tolerated. He's been ambulating to the bathroom. Cranial nerves are intact, but he's been having some decreased sensation in his bilateral lower extremities. He is awake, alert, oriented ×3. He's in no visible distress. He's speaking clearly. He has steady gait. His pupils are equal round reactive to light. And he has intact extraocular movements. His lung sounds are clear in all lobes. His breathing is unlabored. S1 and S2 are heard with no murmurs, no gallops, regular rate and rhythm, no crowded breaths. He's on the diet, 1800 calorie diabetic diet with a 2 gram sodium restriction. His abdomen is flat, symmetrical, not tender. Bowel sounds present, Q4 ×4. He has 5 out of 5 muscle strength in all extremities, no coving, no cyanosis. His skin is intact except for the ulcer on his foot, which is 5.5 centimeters by 2.5 centimeters, 3 centimeters deep. It's pink and it extends into the dermis, not anywhere else. His latest vital signs, we're at 1645, temperature 98.4, respiration rate 18, pulse 76, blood pressure 120/70 with O2 sats at 96. He has a right medium vein forearm IV. It's saline locked. And he is due for his bedtime Lantus right now, so that's what we're going to give him.
So why specifically is the client receiving this medication, and what action does the medication have on the body?
He is receiving Lantus because he's a type 1 diabetic, and it's part of his therapeutic regimen, and he's been dependent on it for some years now, and it works for him, so we're going to give it to him. It inhibits insulin production in the body.
And when should you question administering this medication?
We would question it if he was having any signs of hypoglycemia, anxiety, chills, cold sweats, anything like that, and we would hold it if his blood sugar was low, and we would call the doctor.
Does the medication have a therapeutic serum level?
We're going to be watching his blood glucose levels, obviously, and we also checked his A1C, and it's been good.
And which vital signs must be monitored?
We're going to continue to monitor his vital signs Q8, but we're going to pay attention to his pulse because tachycardia is a sign of hypoglycemia.
And what physiological parameters should be monitored when the medication is being administered?
Again, we're just going to keep an eye on him, make sure we don't make him too hypoglycemic, watch for all of those symptoms, the chills, the sweats, any restlessness that he may have.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
We're going to make sure he knows that it's, this is a long-term insulin. He's going to be on it for the rest of his life. Make sure he realizes he really needs to stick to that, and make sure he's aware of all the symptoms of hypoglycemia. Make sure he's rotating his injection sites and that he knows that that's important.
And what interventions must be taught for taking the medication safely at home?
At home, we're just gonna keep the same thing, make sure he's using the right equipment and he's disposing of it properly, and that he's really sticking to his diet.
And what are the side effects and potential adverse reactions?
We've talked about hypoglycemia, that's the big one. That would be a sign of overdose. So all of those symptoms, tachycardia, cold sweats, chills, anxiety, and also we would be concerned about anaphylaxis, but he's been on this a long time and has no allergies, so we're not really worried about that.
And how you know the medication is effective?
That he would maintain his baseline blood glucose level. Go back to a good level.
Well, thank you so much for answering my questions.
You're welcome. Are we ready?
Yeah.
Okay. Hi, Ronald. How are you?
Hello.
Do you mind telling me your name and date of birth?
Yes, my name is Ronald Jarvis, and my date of birth is 3/23/1949.
Okay, Ronald. I'm Katie. I have a student with me, Rosemary, and we're going to give you your bedtime Lantus. Is that okay?
Yes, it is.
Okay. And I remember that you asked me about some information on the diet, so I have that for you as well.
Okay, thank you.
That way you can look over, and if you have questions later, you can ask me. How was your day? Did you have a good day?
Yeah, so far, I mean, other than just a little tired of being in the hospital.
I know. Well, we'll give you this and you can go to bed.
Hopefully I can get some sleep with you guys poking at me all the time.
I hope so too. Okay, so we're going to pull up the MAR.
Oh, you mean get a fake one? That's what they light. Okay. Why is that speed so?
You can see that his Lantus is due. At bedtime. I'm going to bed now, so we can give it to him.
Or just in the camera, fix what we already recorded, or is that just
Do we click it?
On the box, yeah. Like, when you're ready, yeah, the green button.
You push the green button and you did. Okay, so we have Ronald's MAR pulled up. And we have the Lantus here. We're going to use the two patient identifiers again. Can you tell me that name and date of birth again?
It's Ronald Jarvis, 3/23/49.
Okay, awesome. So that was right. This is the Lantus. His order is 18 units at bedtime. We have 18 units here. It's not expired. Where would you like this, Ronald?
You could put it on my left side of my stomach today. I just did it on the right.
Okay, so good. You know about rotating those sites, huh?
I do.
Good.
Been taking this medicine for years.
I know. I just like to make sure. So we're going to inject 18 units of air. Just double check with the right medicine, the right dose, it's the right time, the right route. We checked with him. We have his name and date of birth, so we're gonna go ahead and give it. Sub-Q. Put this in the sharps. All right, Ronald, how you doing? You okay?
Yes, I'm Devon.
Do you have any more questions for me?
No, not at this time. I'm just tired.
Okay, well, you know that if you feel any of the hypoglycemic symptoms, you're gonna let me know, right?
Yes.
It shows less anxiety, okay?
Okay.
Okay, I'll let you get some sleep. I'm gonna document my injection, where I gave it, how many units, what time. And I think we're good to go.
The yours was the what? It was on the video like that. And see, we didn't know it wasn't.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
When I hit this,
I read his most recent blood glucose, and it was within parameters to give his Lantus, no concerns. He looked good, he was not symptomatic, so.
And why was that important?
Just to make sure that we don't give him too much and send him into hypoglycemia.
Did this information affect your decision to administer the medication?
Yes, it helped me decide that it was appropriate to give him.
Okay. And did this information affect how you administered the medication?
Yeah, I just administered it per the doctor's orders. The way that we always do it.
Thanks again for letting me ask you some questions and sit and watch you while you administered that medicine.
You're welcome. Good luck in school.
Thank you.